Good afternoon. Welcome to another program on Shura Council's Health Program. I'm Dr. Zachariah, and I'm your host for today. Hopefully you're doing well and you're having a wonderful week. We wanted to discuss today a little bit about some common health issues that women have. And to discuss this, we wanted to focus on, number one, the general issues that women have, like men, and also some specific issues that women will have, unlike men. So we wanted to discuss first the top 10 issues that are prevalent in terms of disease for women, and then from that we'll discuss some options for treatment and some alternative treatments that are out there as well. So we wanted to get into that and see how much information we can give you. The leading cause of death for women in the United States is heart disease. So it's like men. Women have caught up, and they've, before it used to be in men only, now it's also in women as well, as heart disease. And of course, with heart disease, we've discussed heart disease multiple times on the show before. We have programs that have discussed heart disease in depth. But in terms of women, in terms of the prevention of different types of heart disease, of course, we know that what affects heart disease, number one is the genetics, number two, the diet, number three, exercise, number four, smoking and alcohol, and number five is just the lifestyle that you have, a sedentary lifestyle. So if we can alter those things in terms of if you're a woman and you do have high cholesterol, or you do smoke, or you do drink excessively, then you can alter those things and change the lifestyle so that you decrease the incidence of heart disease in the population of women, and make yourself a healthier individual. That's the number one issue that usually comes up. And heart disease, it's very easy to diagnose and very easy to kind of maintain and monitor yourself. You have your yearly exam. It's very important for you to go and get that EKG, which is done at your family doctor's office. And if that EKG shows anything, or if you feel yourself palpitations or irregular heartbeats, it's important to call your doctor, let them know, set up an appointment, go in, get seen, and let them do an assessment. The assessment is very straightforward. They'll do a EKG on you. If anything is shown, they'll refer you to a cardiologist. Cardiologist will do a stress test on you. They'll do an echo, which is an imaging of your heart, and see what's wrong, if anything. And they'll get to the bottom of it. The earlier detection, the better your survival rates from heart disease. This is very important. And also there's something called the calcium scoring, which gives you a probability and a percentage of how blocked your coronary arteries are. This is important. Your cardiologist can order that test for you. And it's something very early that'll let you know if you have any type of blockage in any of your coronary arteries. So it's important to keep that in mind. And if you have anything that concerns you about your heart, please see your family doctor and get yourself checked out. And it's very simple and straightforward. The second thing that is a common detrimental factor for women is cancer. And the top cancer that's prevalent in women is breast cancer. And breast cancer, of course, everybody in the U.S. by now knows someone that has breast cancer, or that has had it and has survived it, or has not survived it. It's very important. And the way you prevent yourself from becoming a victim or a statistic in this breast cancer issue is early detection. Very important to have early detection. Your doctor will recommend a mammogram. It's very important to do your mammogram, and it's very important to follow up on it and follow your doctor's guidelines on that. Also, what's more important is your own self-breast exam. If you're a female, after you take a warm shower, all you have to do is raise your arms, and you feel in a circular pattern you feel for nodules or bumps. And if you do feel a nodule or bump that is persistent, then you should definitely go to your doctor and have that checked out. It's very important to do that. All they'll do is they'll refer you to a lab where they'll do a biopsy, needle biopsy, and they'll check what it is, and they'll do a mammogram as well. So, and then they'll keep an eye on it for you. It's very important to do that. That'll keep you from this breast cancer getting further in your body if it is breast cancer. It could just be a fat tissue as well. It could be adipose, or lipoma. The most common cancer in the U.S., of course, is skin cancer, right? So if you're elderly, you're in the sun a lot, you get different types of moles on your body. It's important to keep an eye on them. If they change shape, or if they get larger and they change the shape, it's important to get those seen and then get those cut out by your dermatologist or by some primary care doctors do it as well. That's very important. And then, of course, colonoscopies. It's important, get that at the regular interval that the doctor recommends for you, as well as uterine cancer is another one that's prevalent in females, of course, because they have uteruses, and it's important for you to keep that in check and get diagnostics, get ultrasounds, get blood tests yearly, so that you maintain yourself in terms of free of these cancers, and you have early detection. God forbid you get one of these, and the earlier you detect it, the better your survival rates. It's very important to keep that in mind. Self-exams, again, it's very important. Wear sunscreen when you're out in the sun. Avoid smoking and alcohol consumption. Get your regular diagnostic tests, colonoscopies, etc. It's very important to do that. And if you do that, then you'll be free of this cancer risk, or decrease your risk of getting cancer. The other thing that women face are strokes. Strokes are also a cause of death in women. Every 40 seconds in the U.S., someone suffers from a stroke, and someone passes away every 4 minutes in the U.S. from a stroke. 60% of strokes occur in women. That's 60% of strokes occur in women. And of course, the warning signs, which is a facial droop, arm or limb weakness, numbness, and speech problems. So if you notice that, drooping face, limb weakness, arm, leg weakness, or numbness, and speech problems, that points to a stroke, and you want to make sure that you get intervention right away and taken to the ER. Once you're taken to the ER, they'll give you what's known as TPA, a blood thinner, right away, so that they intervene. So keep that in mind, and that's something important. Remember that 60% of the strokes in the U.S. are in females. So that's something to keep in mind. The other two things that are important across the population and in women as well are diabetes and obesity. Diabetes and obesity are at epidemic levels here in the U.S. now, and it has to do with our sedentary lifestyles and the type of food that we consume. So it's important that if you want to get ahead of this diabetic and obesity epidemic, it's important to change lifestyle and the intake of the types of food you eat. It's very important, very important. 26 million adults in the U.S. have diabetes, and it increases the risk of heart disease and kidney disease if you get diabetes. So that's something which you have to keep in mind. There are many programs that, if you're pre-diabetic or diabetic, that'll help you change your lifestyle and your choice of foods, as well as alter your metabolism so that your sugar metabolism is more efficient and that your insulin levels are normalized. It's very important because a lot of people have insulin resistance, especially females with hormone issues. They have a lot of insulin resistance, and that's the basis of their problem in terms of obesity and diabetes. So get that checked out, get your insulin levels checked out, the production of insulin, and get your HB1AC checked out with the hormones. You need to balance that out in order to keep from getting this issue. Osteoporosis is another byproduct of malnutrition as well as bone density deficiencies. Osteoporosis, 1 out of 2 women will experience osteoporosis, and this is something which they call the silent disease. Most people don't think they have it in their 40s, but a lot of women in their mid 40s suffer from osteoporosis, and they call it the silent disease because they're not screened for it. They don't have bone density tests. Your OBGYN or your family practice doctor should recommend some type of bone density test. And if they don't recommend it, what you can do is yourself, bring it up and be your own advocate and talk to them about it and say, hey, I want to check my bone density out, make sure that it's normal and it's at a good level. Otherwise, you have to supplement, and you have to, take your calcium, your vitamin D, and you have to do weight-bearing exercises that strengthen your bones. And that's very important. Strengthening the bones, vitamin D, calcium, vitamin K, these are all important in bone health. It's very important. Cruciferous vegetables that you eat, the greens, the leafy greens that have iron, is very important for bone health. Also, resistant exercise would be very important for bone health to prevent osteoporosis. And activity and moving and regular exercise regime is very important for you to do in order to keep the integrity of your bones and the strength robust. You don't want to be deficient in that. The other thing that's prevalent in women is depression. Depression we've talked about a few times on different shows, but it's very important to keep that in check. It interferes with your daily life, and what we recommend is to discuss that with your doctor, do your exercises, do tasks that you can complete. It's very important. When you complete a task, you feel good about it. It gets those endorphins and dopamine going. And then, of course, very, very important is to have a good social network. Social network, not online, but in real life. It's important to have friends and family that you can spend time with. Those will be the best things you can do to deter and decrease the tendencies of having depression. It's important to do that. Of course, abiding by your doctor's recommendations, and if you need medication, by all means take them. But those are things that we recommend that you do so that you decrease the probability of depression as well. The 7th thing are autoimmune diseases. Of course, the basis of autoimmune disease is that your own immune cells attack yourself rather than foreign cells. And when that happens, it affects about 30 million women in America, and a higher proportion of women get autoimmune disease than men. It's not something that's preventable, it's something that's genetic. It could be environmental at times, but most of the time autoimmune disease is genetic. So if you have it, rheumatoid arthritis, lupus, things like this, you have to mitigate risks on your organs. It's important to do that. Read about it, educate yourself about it, discuss it with your doctors. I would recommend a functional medicine doctor that can tackle the root cause of the autoimmune disease. It's important to do that. It can also lead to infertility. It can also lead to irritability. It can also lead to other types of illnesses, and it's a cascade. So it's important to get a grip on the autoimmune diseases. It's important to keep your vitamins and nutrients in balance. If you keep it in balance and you're taking a 20-minute walk a day, and you're doing these things, your autoimmune disease can be kept at bay, and you would get less flare-ups as well. So that's important to keep in mind. Again, you have to advocate for your health, and you have to be proactive in doing things so that you decrease the probability of these illnesses. The other thing that most women experience, of course, is menopause. Menopause, you get hot flashes, night sweats, and mood swings. This is something which is common in women that are 45 and older. It's important to keep yourself, if you do have menopause, it's important to keep yourself busy. It's important to keep your weight in check. Take food in a measured way in terms of having a balanced diet. You don't want to have too many carbs or too many proteins or too many vegetables. You want to balance your diet. You want to have a good serving of everything in terms of balancing your nutrients. That's very important. Exercise is important, again, for menopausal women, as well as stress management. Stress management is I think, very important. Stress management is something where if your cortisol level, your stress hormone is up all the time, it alters all other hormones. So it's important to keep that hormone in check. And if you can do that, then you can get a hold on the menopausal symptoms and signs. Also, your doctor might give you what's known as hormone replacement therapy, and they give you bioidentical hormones that help your body cope with the menopause. That's something which is important. Discuss that with your OBGYN or your primary care doctor if she does or he does women's health. That's important. It usually lasts anywhere from a couple years to 3 years. So it's something that's there for the long haul. And you want to have mental acuity during those times as well. So you want to make sure that you're supplementing with all the good supplements so that you're not deficient. And you're maintaining a healthy weight, you're maintaining a balanced diet, exercise routine, as well as managing your stress. That's very, very important. The other health issue that women face is, with family planning. Family planning is very important. Nowadays, women are balancing their career and their families, and it's important to plan that out with your partner and discuss what you want. You want 1 child, 2 children, whatever you want. You want to discuss it, and you want to kind of have proper prior planning moving forward in terms of your family planning. That's important because that can be a huge stressor, especially nowadays with unwanted pregnancies and unexpected pregnancies. It's important to keep that in mind and discuss that with your partner and plan and be ready for something like that and be deliberate about it. And that's something where it'll decrease your stress and increase your overall health. The other thing is, the last thing that we want to discuss with women's health are STDs, sexual and then also transmitted diseases, and bladder health, UTIs. These are common things that exist with the bladder. A lot of women experience urinary incontinence. It's just a matter of muscles kind of fatiguing. So those muscles can be surgically strengthened. It's a very common procedure people utilize if you have urinary incontinence. If you cough and you lose control of the urine, it's a symptom that you should definitely discuss with your primary care doctor. They'll refer you to a urologist, and they can do a simple procedure that strengthens your muscles down there, and your incontinence will be gone. That's something that you can take a hold of very quickly and not let it ruin your quality of life. That's something which is common, and I urge you to get help for that. If you need someone, we have several female surgeons that we know in the area that specialize in urinary incontinence, and that can help you with it. So leave us a comment, and we'll give you their contacts, and you can contact them. For sexual transmitted diseases, it's very important that as a woman, you know your partner, what they're doing, what they're not doing, and to keep everything on the up and up in terms of examinations, in terms of getting your diagnostic testing done at routine times, and making sure that you have your blood tests done, and that your sexual health and the component of your sexual health is monitored and regulated. And it's also something that you discuss with your partner openly, so that you know that you know what's going on with your health, because it's something which is a common place of illness that happens in terms of women, but sometimes they don't communicate about it with their partners, and that's something to keep in mind, to keep that conversation going, so that you can have a good quality of sexual health and not a diseased sexual experience or health. That's something to keep in mind. If you have any further questions or concerns or any other issues that you want resources on, please don't hesitate to contact us and to comment, and we'll be at your service. With that, we'd like to conclude today's program. Hopefully you're having a wonderful week, and we'll see you again. Take care.